Hey, good evening, and welcome to Your Nursing Career Begins at TMH, a virtual discussion hosted by Tallahassee Memorial Healthcare. I'm Marsha Hartline, and I'm going to be your moderator this evening. A lot of you will recognize me as someone who's visited your nursing schools. I've done lots of visits there with you guys. And I'm also a nursing instructor at Florida State University. But for those of you who do not know me, I wanted to tell you a little bit about my role here at TMH and in the community. I am the academic nursing liaison for Tallahassee Memorial Healthcare. And basically what that means is I communicate between TMH and the nursing schools. So a lot with TCC, FAMU, FSU, Kaiser, but also with some of our outlying nursing schools, including Valdosta State, Chipola, North Florida College. So I try to relay some information to the schools that is beneficial, that we hope is beneficial to the students. I also work on special projects with TMH, including the summer nurse internship, which I think several of you have participated in, and if not, will participate this summer. I also work in the community with FSU teaching, and in a roundabout way, I began my nursing career, not at TMH, but in Baton Rouge, Louisiana, almost 26 years ago. I first started out, I wanted to be a pediatric nurse. That was really my passion. I thought that was my passion. That's what I wanted to do. But I didn't get a job offer for peds. And so I got a job offer from oncology. And in fact, that was the only job offer I got. So I always think, and I tell nursing students, what sometimes you think you want and what ends up being what's the best thing and great for you, sometimes is not always the same endeavor. So I went into oncology a little scared, not knowing exactly what to expect. And I ended up spending 6 great years, and I developed a passion actually for oncology nursing. I really love it. After I left Baton Rouge in the oncology field, moved around a little bit and eventually ended up at Tallahassee Memorial Healthcare around 2001-ish area. Worked in postpartum. I thought I'd give that a little try. I did that for a couple years, worked again in oncology, neurology. We had an admission, discharge, transfer unit. So all that being said, I've worked in just about every medical surgical area at TMH. I've experienced a lot of professional growth at TMH, starting as a bedside nurse and moving into the charge nurse role, and from there into nursing management. So I feel like for me, I have experienced a great deal of growth at TMH, and it is a great place to learn and to grow. So that's a little bit about me and who I am, but I wanted to introduce you to the stars of our show today, which are our panelists. And this webinar is obviously intended for nursing students. We want to be able to share with you the experiences of 2 of our brand new nurses, along with the experiences of 2 of our more experienced nurses and how they have grown professionally through their career at TMH. We are very proud of them. We cannot be more honored to have them with us tonight. If you have questions going through this seminar, you can submit them in the chat, and we will be monitoring them as we go along. So hopefully we'll be able to answer some of your questions as well. So tonight, joining us, we have Jennifer Barber, who is the nurse manager of orthopedics. She started here as a brand new nurse, and she's going to tell you a little bit about her journey. We have Laura, who is a brand new nurse in the Bachler Neuro ICU, which is the leading neurotrauma unit in the area. Very proud of that. Ola, who is a neurosurgery ARNP, who actually started as a new nurse on the neurology floor. I was very happy to work with Neuro when I was manager on that floor, and he was a relatively new nurse. And I've watched him progress throughout his career, and he has just made us all extremely proud. And then we have Annie, who is on the cardiac progressive care unit, 3 North, and she is from TCC and also a new nurse. And all of our panelists are extremely hardworking and extremely dedicated to the profession, and we're very honored to have them with us tonight. So we're going to get started. Jennifer, we're going to dive in right with you. You've experienced a tremendous amount of professional growth since graduating from your nursing program and working at the bedside to leading one of TMH's largest orthopedic units. How about you tell us a little bit about yourself and how you landed in this role?
Sure. So I graduated from FSU back in December 2007, and I'm actually not from Tallahassee. I'm from Palm Bay, Melbourne area. So I came all the way up here just to go to nursing school. During nursing school, I did clinicals at various hospitals, and I really enjoyed TMH. So little did I know my TMH journey started pretty early in nursing school. So after I graduated, I decided to stay in Tallahassee and, thinking about it, let's go ahead and give TMH a few years and I'll decide what I want to do. Like Marcia, I've kind of worked in different areas. My passion, or so I thought was my passion, was working in postpartum. And I actually never even got called for an interview. So I kind of moved on and I got the phone call from orthopedics. And I have never done a clinical in ortho and did not know anything about it. But you know what the heck? Let's just go and do this interview and see how it is. So I interviewed with one of my former managers, and it really wasn't even an interview. It was more of a friendly discussion of, what I wanted in a floor as a new nurse. And throughout my tour of 6A orthopedics, what I found out that was important to me as a new grad is having the support and having a floor that really has great teamwork. And ultimately, that's why I picked 6A orthopedics at TMH, because I felt like I would get that support. Anybody can learn ortho, and I did. And it's something that, nurses can do anything, any real, different department. I've actually did ortho for a few years, that I went up to oncology with Marcia for a year on a different shift and realized that, I am an orthopedic nurse and I really enjoy that. So 13 years later, my time at TMH, I've been a bedside nurse, I've been a preceptor, I've been a charge nurse on weekends. I really felt that prepared me for a role as assistant nurse manager. So did that for 4 years, and now here I am as nurse manager. And the thing about that is that I never thought in a million years I would do management, but the support that I have throughout this organization has really prepared me. And, as nurses, you're constantly learning new things every day. And to be able to have that support is very, I'm just very fortunate to have that. Over the years, for new grads, I personally have been there, done that. I've been a preceptor, but as a manager, I really enjoy watching new grads grow. The amount of growth that they have, it's not just during your orientation. You have new graduates have a very steep learning curve their first year. And for us to realize that, especially through our nursing residency program, but to have that support for them that first year is we're very lucky to provide that for our nurses. So, in general, it's a great program. It's, TMH has done wonderful things for nurses as well. And, I really wouldn't be here in this position if, I didn't stay with TMH because of the support.
Jennifer, explain a little bit what it's like to orient new grads on your floor. Like, what's the orientation process in general?
So the orientation process in general, we do an 8-week orientation. And during that time, you're going to be paired up with a preceptor. And when you're paired up with a preceptor, you have their schedule, you have, for the most part, but, we also want to make sure that you pair well with that preceptor. That's a huge component to your orientation and it being successful. So during that time, you're going to meet with management or an educator each week so that we can discuss your progress. There are things that come up. If you felt like you need more practice with something, then we would be able to provide those resources to you. So it's all about open communication and making sure that you're comfortable when it comes time to being off of orientation. Now, when I say when you're off of orientation, you're still going to have those resources of your peers checking up on you, management checking up on you, educators and so forth. It's not that, oh, you're done and that's it. You're still going to have those questions that the charge nurse will be there for you. Or even if it's a question that the answer to, nurses do this all the time. They need validation, and that is perfectly fine.
Perfect. Thank you, Jennifer. We're going to come back to you a little bit later, but first we're going to move on to Laura. And Laura is our newest grad on the panel. She is an RN in Neuro ICU. So Laura, tell us a little bit about yourself. What brought you into TMH?
Sure. So I graduated from Florida State in December 2020, so not quite a year ago, after doing the ABSN program there. So real short, 1-year program. And I really just in that time, our clinicals were interesting during the pandemic year, right? So we had sort of limited time in the different hospitals around town, but I just really enjoyed my experiences at TMH, and then when I interviewed and was able to speak with the nurse manager and shadow some of the nurses on the floor here, the teamwork, to echo what Jennifer was saying, just really drew me in. Even just spending a couple of hours with a nurse during my interview helped me see how well the nurses on the floor work together, and that's really what I was looking for, was a place where I felt like everyone supported each other, and as a new nurse where I felt comfortable asking questions, especially in any new area, right? It's all new when we just graduate, and I've never felt like I couldn't ask a question to anyone that's on the floor with me. So I've had a great experience so far here at TMH.
That's awesome. What do you think has been one of your most rewarding experiences so far as a new grad?
That's a good question. I think just really connecting with family members and being able to sort of, the education piece, help explain what's happening to family members if they're scared, or sort of talk to them about the next steps and help them to feel heard during their time here and feel like there's a good sort of conduit from the nursing staff through, the whole healthcare team, just sort of working to make sure that the communication for the patient and the patient's family is really outstanding.
Perfect. Perfect. Thank you, Laura. We appreciate you sharing. So Ola, you're up next. So Ola, can you tell us about what led you to TMH, and tell us a little bit about your journey, because you've accomplished quite a lot in the past 5 to 6 years since you graduated from nursing school. And Ola doesn't mind sharing with us that he also manages his career with sickle cell disease, and which he manages flawlessly. So if you could tell us a little bit about your journey, Ola, we'd love to hear it.
Where do we start? Just like Marsha said, she's known me quite a long time. She's seen me go through my journey. it's been quite a path. It's to manage sickle cell and to be drawn to healthcare and to accomplish what I've accomplished in such an organization, and to be sitting right here on this panel right now and having this conversation with you guys who are the future of healthcare. It's amazing. It's a great pleasure. Like it's breathtaking almost. Because I never thought I would be sitting right here. So let's start off with where I was born. I was born in Nigeria. I left Nigeria when I was 10, and I kind of came to the United States at a young age. My parents, they didn't really have much, and I kept getting sick. My sisters, my siblings all have sickle cell. I kept watching that whole traumatizing experience, and the more I watched it, the more in love I became with nurses versus everybody else that was part of the healthcare team. Almost, they were the forehead of the whole team. They ran the show. They took over. They told the doctor what they needed. It's a great, comfortable setting for individuals who are willing to work hard to build their confidence and get to the stage where they are, you become like me, a nurse practitioner. Now I'm, the next best thing to almost a doctor, not downplaying a medical doctor. I get my cases and I run it by them, and they agree with me or they disagree with me. And this whole journey has just been fun. But that's kind of how I fell in love with nursing. I took it upon myself. I went to nursing school, shadowed one of my auntie who's now a DMP nurse practitioner, and she now runs her own facility. And that's kind of where that was more promising for me to actually see the evolution of nursing and kind of see how far in nursing you can actually go and the potential that you have if you can stay consistent and just keep the drive going. Because you guys, believe it or not, you guys are the future of this dream that we have. It doesn't stop with me. It starts with you guys. You guys are the next best thing. Like Laura said, she's a new grad, but she works in one of the most vital part of TMH. We do a ton of surgeries, stroke interventions. We do a ton of those things, and they get to see it firsthand. So it's an amazing journey. It's an amazing field.
So how did you manage going back to school and working?
I had a lot of sickle cell crisis. I just battled through it. But dedication and a lot of support. I've been at TMH now that I'm not so, I'm still a TMH nurse, no matter which way it goes, right? I've been there for at least about 5 to 6 years, like Marshall said. All the doctors there, they knew the ambition, they saw the dream, and they kind of pushed me right along. Whether it was waking up late hours or staying up late hours and trying to find my next preceptorship or trying to locate the next person who's going to teach me how to advance my skills, they were there to support me. They sent me numbers. The organization is just it's a big family. It was great to kind of be part of that, still have my crisis, deal with those things, grow from it, and still have the village to kind of help me, groom me into where I kind of sit now. Even as far as taking the nurse practitioner position with TNC, just like, like a few of the panelists on here, we never really have a job interview. It's more so like, hey, I hear you're in school.
Doing well.
It really is. I hear you're in school. I heard you're doing amazing things. Yeah, I would love to have you.
Right.
Let's talk about it.
Lots of room for growth.
Yeah.
Lots of room for growth. And I think, Ola, you really hit the nail on the head when you said there's support for you at TMH. And that is so true. If the sky is really the limit for whatever it is, whether you want to have a trajectory in ICU or nurse practitioner or management or remain at the bedside for your career, whatever it is you want to do, there is support around you. And I think Ola is an amazing example of people supporting him and his attesting to never giving up, which is, I think, the backbone and the core of a lot of success. So thank you, Ola. We always love to hear your journey, and you're a great inspiration to many people. So last but not least on our incredibly talented panel is Annie. Annie is a TCC graduate last summer, I believe. She can correct me if I'm wrong. And she works on CPCU, which is the Cardiac Progressive Care Unit. So Annie, tell us a little bit about yourself and what led you into TMH, into 3 North, the CPCU, and your experiences so far with the nurse residency program.
Yeah, so hello everyone. So my nursing journey first started, I guess you can say, or my path to nursing first started when I was 11. So that was the year that my dad was actually diagnosed with leukemia. And so we spent many days in and out of the hospital. You know, I went with him to a lot of doctor's appointments, you know, when he was going through chemo. And throughout all of it, just the nurses were absolutely amazing. Out of all the doctors and other, you know, healthcare workers we met, I just always remembered the nurses as a little girl. They were so nice to me. They made sure that I was okay, made sure that I wasn't scared, make sure that I kind of, you know, had an idea of what was happening. And so, you know, as I went through high school and started thinking about what I wanted to do, I realized when I was 16 that I really wanted to be able to be that person for someone else, to kind of be that support person and be there to guide them through a really tough and really scary time. And so after that, I talked about it with my guidance counselor. And so I was actually able to dual enroll and finish a lot of my nursing prerequisites while I was still in high school. So that way, when I graduated and I turned 18, I went straight into nursing school. And so that same semester, I actually, you know, decided that I wanted to get some healthcare experience. I kind of wanted to get my feet wet while I was in nursing school. And so I also decided to accept a position as a nurse extern. So now I work on 3 North, but originally I started out on 2A, which is the clinical decision unit. And I have a lot of love for that unit. I learned a lot working with those nurses and those techs. I really learned a lot. I had really amazing managers. But as I kept going through nursing school, I realized that I was really interested in cardiac. That was definitely my favorite subject to learn about. I really enjoyed it. And then in my 3rd semester, I actually got to do my clinicals on 3 North. And so after that, it just really sealed the deal for me. Although I really enjoyed the other floors that I had been on. When I went to 3 North, the nurses there just really stood out to me because they just all loved each other. They all just had amazing teamwork. They were so nice to me. They kind of just took me under their wing and showed me everything. They taught me a lot. And even the management on that unit is wonderful as well. They both, you know, always made a point to say hello to me, even as a student. And so I just was really drawn to 3 North. So I also got to precept there in my 4th semester, and then I decided to accept a job with them after I graduated.
Very nice. And you know, one thing about Annie that I forget, so when I was on 3 North and got to know Annie probably a year and a half ago when she first started, I had no idea I hope you don't mind me sharing this, Annie, that she was as young as she is. So, and I'm friends with her on Facebook, and then all of a sudden her memories or not even memories, she's celebrating her 21st birthday. And I'm like, wait, well, how old is Annie? And so she's very young. She started nursing at 20, right? You
Yes.
came on 20. And so kudos to you. That's amazing. So it just goes to show that there's so many ways to enter nursing as dual enrollment and get those credits under your belt. And really it's a fast track TCC and other 2-year programs to get into the nursing field. And then you can go back and get your bachelor's degree if you want to. So she's a great example of that. So thank you, Annie, for letting me share that. But tell us what it's like to work as a brand new nurse during a pandemic. And you probably don't know anything else just because that's all you've known. But what are your challenges that you feel that you faced being a brand new nurse during a pandemic?
So I feel like all of the pandemic new grads, I feel like we're almost like a new breed of nurses because, you know, we've really been baptized by fire in a sense. You know, I remember I started in September of 2020, right after I graduated. and I just did not expect the craziness at first. So, it was definitely very challenging, especially in the beginning, but kind of like everybody has been saying, I have had so much support along the way, not only from my preceptors, but all of my coworkers. And then I know we'll talk more about it, but then of course from the residency program. So it's definitely been very challenging because people, not just COVID patients, everyone is just sicker. We're about to enter flu season again. And so it was definitely very, very challenging. But I also feel like it has made me a much more resilient nurse, even though I've only been a nurse for 1 year. People tell me all the time, even providers tell me that they have no idea that I've only been a nurse for 1 year. So it really has, I think, pushed me in a lot of ways. It's made me grow in a way that I don't think I would have if I had started before COVID. So definitely very challenging, but very rewarding at the same time.
Very good. And I think you bring up a very excellent point too, that it has made you stronger. So a few years down the road, it's going to almost seem a little bit easier because now you just get to be a nurse during a regular time.
Exactly.
So, and then you also have the war stories to tell. It's like for this next generation, well, I went to nursing school during a pandemic. So I always tell my students that's kind of a badge of honor that you can wear. So thank you all to our panelists, and we're going to come back to you a little bit shortly. But I wanted to talk about the nurse residency program. So a lot of people get nurse residency program and the nurse preceptorship confused. And they are dual programs. They work in tandem. So every single new nurse who comes into TMH, we tailor an orientation program for you. You're put one-on-one with an experienced nurse, and you work that nurse's schedule, usually for about 8 to 10 weeks. And you learn how to take care of patients on that floor. And there's usually a nurse educator or a charge nurse or someone who's following up with you, making sure that you accomplish milestones along the way so that when you are done with orientation, you are comfortable. And even when you are done with the orientation, you have a plethora of support. You always have a charge nurse. You have the nurse next to you. It's all about being a team. You're never alone. That's, I think, a very good point to come across. You are never alone in the field of nursing. So that is your orientation, your preceptorship. The second part of being a new nurse is that you are enrolled in the nurse residency program. And the nurse residency program is an evidence-based practice program from Vizient that we employ, and in all of our new nurses are enrolled in this program. You meet once a month, and we put you in what's called a cohort. So any other new nurse who has started their career right along the same time you'll be in a cohort together. And what that means for the next year, you're going to meet once a month together in a smaller group for 4 hours a month. And your nurse manager knows when those days are. They're scheduled in advance, so you're given off. You don't work that day, but you do get paid. You come in, you clock in, you're paid to learn, basically. And we bring in speakers who address issues that we feel that new nurses sometimes have a little bit more of an uncomfortable experience with. For example, wound vacs is always stresses people out. So we'll bring someone in from wound therapy to explain wound vacs. You can do hands-on, put your hands on the wound vac so you can kind of understand how to use that. Another one of our topics is provider communication. Calling the provider, nurse practitioner, PA, physician, whoever it is always very daunting for a new nurse. So we talk about that. We talk about the best practices and when to call and how to call. We do all sorts of smaller classes like that. We do something called Tales from the Bedside, which is even a smaller group, almost like a support group for you, where you talk about things like your first patient death, or maybe your first code, or whatever is. You talk about the first patient that sent you a thank you note. We do accolades too, but it's a support for you. And what we have found is the residency program keeps you in nursing and supports you longer than nurses who are not in a nurse residency program. And that is national data that supports the use of a nurse residency program. So my advice to you, no matter where you go for nursing, which we hope would be TMH, but always make sure that you are involved in a nurse residency program, because number one, like I said, it's evidence-based. And number two, it shows that the organization that you're working for has invested in you and wants to support you during this first year. Because believe it or not, you're most vulnerable to fall out of the nursing profession altogether that very first year. So if we can support you that first year, we feel like it will not only benefit you, but it's going to benefit society as a whole, because we get to keep you in the nursing profession. Laura, question for you. So what has it been like for you in the residency program? Because you are still in the residency program, correct?
I am, yeah. So we have 1 or 2 sessions left, and it's been really good in a few different ways. So I'd say, first, I love meeting nurses from different units and hearing about their sort of their struggles and their successes, right? So sort of the different things that we're all going through, but that we're all going through together in a way. So we talk about those at Tales from the Bedside, as you were saying. But I think it's also a good way to engage in that way with other units. But then also when we have speakers come, or when like we did a mock code and had some like a neuro quiz was part of that. And just we had leaders from different floors who came and worked with us that day. And I've seen some of those people again. So it's nice to know, to have some resources outside of the unit, people that we know and feel comfortable with and have met and have talked to about, where we are in our journey. So it's really just really great, not only for the skills that we're learning, but I would say also for the networking, for sort of extending the network of people that are good resources.
That's a very good point, because I always tell everyone, when I worked as charge nurse, and there would be a patient that come to my floor or come to the floor that had something unusual that I hadn't really seen, I know where my resources are. And I can just remember I had a patient with a continuous bladder irrigation that I hadn't set up in probably, I don't know, years. And I'm like, oh my gosh, I really don't know. And the other first floor nurses knew, but I knew where my resources were. 3A, 3C, I called the charge nurse, hey, can you come help us? And yes. So you may not know exactly or everything. No one's ever going to know everything, but you know where your resources are. And it helps in the residency program. You get to know nurses from all over the hospital. It's not just nurses that are in your unit that you participate in the nurse residency program with. So it is a very good supportive way to get to know peers throughout the hospital. So thank you, Laura. Annie, what is your advice? How have you benefited from the nurse residency program?
I've definitely benefited in a lot of ways from it. We've been able to learn all kinds of stuff. You talked about all the different types of little seminars that we've had over all kinds of stuff. So, about the wound vacs. In particular, I really enjoyed the one about palliative care and end of life. I learned a lot. I think it was 2 of the nurse practitioners that came and spoke to us about it. And it was very informative. I also really enjoyed the mock deposition that we had. That was also very informative, because in school they don't teach you a whole lot about charting and different things to watch out for. So I really did enjoy that. But I think my favorite part of the whole program was definitely Tales from the Bedside. Having that smaller group and also having that facilitator to kind of just talk through everything, because as a new grad, you're going to be experiencing kind of a roller coaster of emotions. There's going to be a lot of highs, a lot of lows. So it really just helps having a group, having a safe space that is there for you. They're going to understand all the emotions that you're feeling. They're going to laugh with you, cry with you. You can kind of just tell them anything that happened, anything that you need to talk out. I found that really helpful as well. And even the information that we got about communication, about conflict resolution, that really helped me a lot, especially when I started precepting new grads, which I was very intimidated by. That really helped me to kind of come at it with a good approach and not go into it blind, so to speak. So the residency really does teach you all kinds of different skills and a variety of different things.
Good, great. I personally am a huge fan of the residency program, and I'm glad to hear that it's doing exactly what it's intended to do.
And I'm gonna
So
chime
thank
in.
you all. Yes, sir, Ola.
You know, and funny thing is, I actually was a part of the nurse residency program, and I think it was a great idea. It was the very start. Me and my best friend probably just left college as nurses, and we ended up selecting neuro as our place of home, and we grew so much of a bigger bond working because we created a friendship. We had both friendships, friendship outside of work, friendship in work. We had each other's back at work. We had each other's back outside of work.
Yes, you did.
But work was totally a different place. We were new. We didn't really know too much, but we bounced idea off of each other.
Right.
And he would constantly remind me, bro, it's okay. You don't have to know everything. Let's call Marsha. Let's ask her. Let's see what she thinks, and then let's go from there. So it's a great program. It's a great resource to use. It's a great way to grow as you continue your career in the nursing field, wherever you decide to go. Like Marsha said, I would definitely look for my company to have a nursing program or a nursing residency program to kind of create that ladder that you need out of school. Because you're coming fresh out of school, you're thinking you may know it all. You passed your board exam, so they're telling you, yeah, you know your stuff. But when you hit the ground running and you're getting used to the environment and you're starting to realize, wait, there's an emotional tie to this, because you don't get to go through that in school.
Right.
The only emotion you get to go through in school is, man, this is really tough. The rest of it, your patient, your palliative care patients, providing care for those patients, sitting at the bedside, holding your patient's hand in traumatizing environment, trying to calm them down, tell them that it's going to be okay. You don't get to go through those things in school. So the nurse residency program kind of established that ladder of cope with your own, learn from yourself and kind of create a standard for yourself where you are okay with dealing with things like this, because otherwise you're going to burn yourself out and you're going to drop out of nursing as a career. But it's really a great field.
That's exactly right. And that brings us to a very good point that kind of like what prevents you from burning out? What do you think is the advice for nurses today during a very challenging time to be in the nursing field? That's not a secret. Do you have suggestions? And this is for any of our panelists. Do you have suggestions for our brand new nurses as they enter their nursing profession and what they can do to prevent burnout?
I think, you have 3 days at work, 4 days off. Using those 4 days off to the fullest was really important for me, especially when I was brand new, fresh off orientation, making sure that I was taking time for myself to do things that I knew I enjoyed, things that I knew were going to fill my cup. And taking an active effort to make sure I did that definitely made me a better nurse, made sure that I was happier at work. And of course, things that are basic, getting enough rest, getting enough water, trying to eat something decently, not ordering takeout at work every day. So
That's easy to do.
Yes, definitely. So, taking good care of yourself and making sure that you're doing things that you're passionate about and things that you enjoy outside of nursing as well.
Jennifer, what do you think?
I think definitely keeping that open communication with your coworkers too. There's so many things that, when you're talking with somebody and it's just like you're peeling the layers of what, could be a problem and addressing that head on. And, we've all have been there. We all have done that. And what I have learned in management, I never ever thought that we'd be going through a pandemic. I mean, none of us thought. So you have these new nurses that are coming into something completely new, and that is nursing. And then you have, your seasoned nurses, and you have to be flexible. We all went through, COVID, different variants, and we've had to change things around. And really what it comes down to is being flexible and how can we manage our patients in our community, because we do have to adapt to our community, and what can we do to do that together and maintain. So that was one of the biggest things. And fortunately, you know, like everyone has said, TMH is a family, and we've had those rough shifts, and we had those shifts where, you know, it's been going great. And you know, just being there for each other too, and being able to talk about those things.
Very good. Any more insight from anyone about the nurse residency program? No. It's a great program, and I can't, like everyone on this panel has said, I can't recommend it enough. So thank you all for your insights. We're going to kind of switch gears a little bit and answer some questions that's come through the chat. So if you have any questions for us or for any of the panelists, be sure to put those in the chat, and we'll be monitoring those and can answer those for you. So one of the questions we have is, can a brand new nurse where can a brand new nurse start? Do we hire brand new nurses in the ICU or ER? So yes, we do. We hire brand new nurses throughout our entire organization, and that includes ICU, ER, OR, labor and delivery, all of our med-surg units. We hire brand new nurses into all of those units. Another question we have is, how long do you have to be a preceptor, or how much experience do you have to have before you become a preceptor? And that really just depends on the nurse. Some nurses are ready to be preceptors quicker than others. So we don't have a specific minimum, you have to be a nurse a year, you have to be a nurse 2 years or 5 years. What we look at is your competency, and the competency of that nurse, and the comfortability of that nurse in orienting new nurses. Do we offer a sign-on bonus for nurses coming into the nurse residency program? No, we do not offer a sign-on bonus right now for our nurses coming into as a brand new nurse into the nurse residency program. But what we do offer is we have a lot of benefits, healthcare benefits. We offer pet insurance, believe it or not. I think that's very unique to our organization. We have very highly discounted rates at Premier Health and Fitness Center. We have a child care center on site that is supplemented through TMH. So we have lots of support from TMH for our new nurses into the nurse residency program. Let's see, another question we have is, the nurse residency program competitive? I'm not sure I understand the question totally, but I'm thinking that you want to know, will you have a job? Yes, you will have a job. It depends on what units. Some units have more vacancies than others. Smaller units, let's say the NICU, they're smaller units, so they're going to have less openings. Bigger units, we have more of our medical surgical area units. They're going to have more opens just because there's more different types of units. We have oncology, ortho, neuro, postoperative, CDU. I mean, just to name a few, we just have a plethora of different opportunities. And speaking of opportunities, TMH really does offer every single type of service, really, other than we don't have a burn unit and we don't have a transplant unit. So let's say you don't really know exactly what unit you want to be on. You like orthopedics, you like ICU, you like mother baby, you know, help, what am I going to do? Well, this is what we offer. We offer shadowing opportunities, and I highly encourage you to come shadow with us. So you can reach out to me, and I'll tell you how in just a few minutes, but you reach out to us and tell us what you're interested in, or you can apply to the nurse residency program online. Tell us, you know, I'd like to shadow on the oncology floor. I'd like to shadow in the ER, and we'll set those shadows up for you. So we'll schedule those. I'll give you, it's either me or 2 other people that work in the organization. Usually given the tours. We'll give you a tour of the whole hospital, and then we'll go back and we'll let you shadow with a nurse one-on-one on the unit that you're interested in. And what that does is it lets you know what kind of people, what's the team work like there. What's the patient population that is on that unit? and see if you think that's a good fit for you. And 99% of the time, after you shadow or after a person shadows, they have a clearer idea of where they would want to be. And I caution you, if you go to another facility and you want to shadow and they won't let you shadow, to me, that's a big red flag. You know, what's going on that they don't, you know, that's kind of behind the doors. So you always want to immerse yourself in the environment that you're going to work. And we're all about shadows, and I'd be glad to set those up for you at any time. So let's see what other question we got. Are experiences like LPN or CNA play a factor in pay of new nurses? Yes, they do. So if you've been any kind of healthcare experience, we take that into consideration. So we have a base rate of pay for our new nurses, and that's for all new nurses across the board. But if you come in and you've been a CNA or you've been an LPN or you've been a paramedic or whatever you've done in the healthcare field, then our HR department will look at that and they will factor those experiences into your pay. It's usually not substantial. It's not a lot, but it is actually factored into your rate of pay. And then something else you need to consider when you are looking at rate of pay or what your differentials are. So let's just say your base rate of pay is $25.50. That's what you're going to get as a brand new nurse. So what's the differentials, and what does differentials mean? Well, differentials mean the amount of money you're going to get paid above and beyond your base rate for working a different shift. So let's say you work weekend. Weekend differential is 10%. You make $25.50 base per hour. You're going to get your 10% differential for weekends. That's $2.50. So you add your $25.50 and your $2.50, and that's what you're going to get for working weekend day shift. If you work evening shift, that's 12%, and if you work night shift, that's 15%. So you have to add those differentials on. So let's say you work a weekend night shift. You're going to get your base pay of $25.50. You're going to get your weekend pay of $2.50 or 10%, and then you're going to get your nighttime differential 15%. So all those differentials add on to your base rate of pay. We also give a differential for BSN. So if you have a bachelor degree, I think it's another 75 cents or an hour per dollar per hour that's added on to your base rate of pay. And we also give certification differentials. So after you've worked about a year in your area, it's usually a year minimum, and you become proficient in an area, you can sit for a national board test in that area. Let's just say it's orthopedics. You can sit for a national certification in orthopedics. And then we're going to pay you, we're going to reimburse you, number one, for the cost of taking that test, because it's usually a couple $100. And then after that, we're going to give you a differential for taking that test. So I encourage you, when you're comparing organizations, look at not only your base rate of pay, but your percentage of differentials. Some people just give differentials, say, I'm going to give you $1 more per hour, $2 more per hour for evening or weekend, but a percentage is actually more so than that flat base array a lot of times. So just make sure you kind of take those all into considerations. Anything from our panelists, anything about all of that you can think to add as far as what new nurses typically ask about placement and shadows and pay?
I would say, follow your intuition, because if you're kind of stuck in between 2 or 3 floors and they are just vastly different, that's what I'm finding in a lot of new grads. They want so many different areas. They're interested in so many different areas, which is great. But when you come down to one, how do you choose? And, follow your instincts, go from there. As for me personally, if people pick orthopedics or 6A, you're not going to be here forever in a day. What is going to be your 5-year plan? Do you want to go to ICU? Okay, that's great. Come to ortho, get your experience. And, if ICU is where you want to end up, what can I do to help you get there too within, TMH? So yeah, definitely follow your instincts and your intuition when picking a floor.
Very good point. Another question is, what's something you learned in nursing school that you use all the time? Anybody?
Anatomy and physiology.
Yeah, there you go.
That's something I use on a daily basis.
Very good point.
And like Annie said, just follow your intuition, and the rest of it just kind of fall in place. I know Marshall brags on me about my growth and my process through this whole span of maybe 5 or 6 years that I've been into nursing, but it really it just kind of stemmed from my environment and my support systems. Really, stepping floor into TMH, I was just a monitor tech. I never for a second thought, man, I'm gonna sit down and take the nursing exam, the NCLEX. I never thought I would sit down and take that, but here I am, like, just graceful that Marsha saw something in me and she pushed my ambition, and she would specifically tell you there was times where she had to pull me to the side and have a conversation with me about, taking water breaks or going too hard on a shift, or, my patient is crashing, so I'm standing at the bedside, but I haven't had lunch all day. It's okay. So it's a support system. It's the people that care about you that keeps you going, that keeps you pushing. Trust your intuition. I went from the nurse residency program through the whole entire neurology unit, from the floor to NICU to VNICU, then to cardiac, and then to back to school, and now I'm here. So it's been quite a great journey, and trust your gut. Trust your gut. Nothing like trusting your gut. It takes you further in life than you would ever think. And trust the people around you. They see something in you sometimes that you don't see. They will push you through.
That's very true. That's very good advice, Ola. Another question that I get is, when do I apply for the nursing residency program, or when do I apply for a job? Well, here's my advice: as soon as possible. So let's just say you're going to graduate in December. You should be applying right now. And the reason being is that we don't take all the applications and we don't hold them until everybody applies, and then we pick and choose and interview and place people. It's a rolling, right? So if you apply right now, and let's just say you want a job on one of the units that are smaller, say NICU. Well, whoever applies first and whoever interviews first and whoever's qualified first is going to get that job offer first. So if you wait till the middle of December, you're going to be behind a little bit in that curve. So if you're graduating in December, I would say go ahead and apply now, and then we'll get your interview started. And that gets you into our system, that gets you kind of on our radar, and then that gets you in the shadow process. We can start giving you the shadows, and you can start seeing of the different units. And then when we do offer you a job, you'll have 2 different options for being a brand new nurse at TMH. You can either, one, say, I want to wait till after I graduate, until after I pass NCLEX, and then I'm going to come aboard as a registered nurse. Come aboard as a registered nurse after you pass NCLEX, put you in orientation. Or your second option is, after you graduate from nursing school and after you get your testing number, you have to have your testing number, then you can come aboard as a graduate nurse or a GN. We pay you the exact same thing we pay you as an RN, and we go ahead and put you in orientation while you're waiting to take the NCLEX. While you're in orientation, you'll be obviously learning how to become a registered nurse, and then you're going to be taking your NCLEX during that time. One big advantage of being a GN is we now offer coaching or tutoring for the NCLEX. We have a national certified NCLEX coach that will tutor you, and he has so far 100% pass rate for every single person at TMH that he has helped coach. We don't offer that to everyone. Obviously, for financial reasons, we can't offer it to every single person. But if you're going to be an employee of ours, then we're going to offer that service to you. So that is one big benefit that I always like to tell soon-to-be nursing grads about. So what's the criteria to be a charge nurse? And do we have tuition reimbursement? Criteria to be a charge nurse is you got to be calm. A little bit of experience. I was laughing because it's not always a calm job. But you do have to have a measure of calmness about you. You do have to have some experience. Now, do we say, just like anything else, what's the qualifications of, for being a nurse preceptor? Is it 6 months? Is it a year? There's no magic number. Some people are very much ready to be a charge nurse at a year, and other people are not, because you do serve as a resource. You have to be somewhat of a little bit of an expert on the floor that you're working on, because those people are going to be, all the nurses and the staff are going to be coming to you for advice, as a resource. So you have to be able to supply or provide a resource to the nurses on the floor. So there's no hard, fast rule in the criteria, other than you need to be competent in your area, you need to be calm, and you need to be professional, because you will be dealing with patients, families, physicians, anyone who calls, nursing supervisor. You're going to be juggling patient placement and room placement. And so it's a little bit of an experience and a whole lot of personality and comfortableness on that environment. Tuition reimbursement, we have tuition reimbursement if you are a bachelor or an associate's prepared nurse and you're going on to get your bachelor's. At this point right now, we don't have a reimbursement for a nurse practitioner, but maybe in the future we're looking at that. But for right now, if you're an associate's degree nurse, we do provide tuition reimbursement for the bachelor's degree program. So I know we're getting really close to time, and I'm very talkative and I talk a lot. So panelists, any final thoughts, anything I left out, anything you want to add? No, I think we did it. So if you are interested in working at TMH, which I hope you are, or if you just have questions about the nursing field, it doesn't even have to be related to TMH. You just want to bounce something off of us, you can email me, and we'll put my email in the chat. It's marsha.hartline@tmh.org. And if I don't know the answer, or if you want to connect to one of the panelists, I can provide you that once you email it to me. And when you go to apply the nurse residency program, another point is you don't apply for a particular unit. Say, oh, I really want to work in ortho. Well, you don't go look for an ortho position or a NICU position or ER position. There's just one application for new nurses, and that's the nurse residency program. So you can find that at tmh.org/nursing careers, and just search nurse resident. And then you apply in that nurse residency program, and it's just that one application. So we are extremely happy that you joined us. Thank you all to our panelists. Very, very appreciative. We have such amazing people that we work with at TMH, and just so grateful to be a part of a community, because we really are a community. We have a community feel inside our hospital, but we also provide the most advanced medical care to the community and surrounding counties around Tallahassee. So thank you all for being nurses, becoming nurses, because we need every single one of you and more. And please stay in touch and let us know if we can help you along your nursing journey. So good night, everybody.
Bye.